Hi, and welcome to the September 19, 2012 Plastic Surgery Journal Club. My name is Damien Marucci, and this is Dr. Pedro Valenti, who's a plastic surgery registrar with me out at the Children's Hospital at Westmead. So, Pedro, we did 4 papers today. What was the first paper? What was that?
That we were looking at the infantile hemangiomas. It was a Keystone and Green's paper out from Boston, Massachusetts. That was essentially looking at the clinical evidence and when involution of the actual infantile hemangiomas, when they actually start showing a decrease in the progression of the involution. And
now that paper there was coupled with the classic paper.
Yeah, from Mulliken's, that's correct.
Which was the Mulliken and Glowacki paper, which basically defined the world of vascular anomalies into hemangiomas and vascular malformations.
Correct.
And so the infantile hemangioma paper from the current PRS basically was looking at involutional phase and when maximal involution had happened. Now, what did people think about these two papers?
Well, the big thing is essentially looking at the actual the 2012 paper by Green. Essentially, they're talking about when the involution phase was, which we'll talk about. The big thing was the 3.5 years.
Yes.
Now, what people were actually saying, look, you know, is this still the go, so to speak? Because we're still calling and talking about Bauer's sentinel paper back from 1976, I think it was, whereby 50% of actual patients were resolved by 5 years and 70% of that resolved by 7 years, and that's obviously very conflicting with what this current paper is talking about, which is a 3.5 year cutoff.
Yes.
That's a big thing, I
yes.
think.
So people were saying that this could in fact lead to a change in practice, whereas before parents would be advised not to have their hemangioma treated until the child was much older.
Correct.
Whereas this paper suggested that at a median age of 3.5 years, the hemangiomas had maximally involuted. One of the comments made during the discussion was that this was still only the median age.
Correct.
Which meant that obviously there's 50% of them still hadn't maximally involuted at 3.5 years of age. But certainly the overall push for the paper was to definitively treat these hemangiomas perhaps at an earlier stage rather than waiting, subjecting the child to a number of more years of putting up with the hemangioma.
That is correct, yeah. Essentially that is exactly what you said. It's a median age that we need to look at, but it should be still on a case-by-case basis essentially.
But overall, look, we know there are people watching from Boston and Harvard, and we thought you did good. Okay, now we're going on to the next paper we looked at was the Keystone Island Flap Reconstruction of Parotid Defects. This is from Behan et al. From Victoria in Australia, and this is from the current 2012 PRS. And this paper just basically looked at a series of cases where parotid defects were reconstructed with some form of Keystone flap. Now, what did people think about this paper?
Look, I think the overall general consensus was actually a very good paper. I mean, we're looking at an Australian author, a prominent Australian author, that's looking at a Keystone as opposed to the clinical, typical free flap options that we have for large parotid defects. I mean, 62 patients were looked at in this particular study with 63 defects, and essentially, basically, look, I think the overall response was very, very good. I mean, we did comment on the fact that not all the actual examples were actually classified into size, and looking at some of the actual closures and so forth of some of these defects. But look, overall, I think the outcome was quite good.
Yeah. Some of the comments made were that they thought it was an excellent paper. It's the kind of thing many of the surgeons present thought they would like to use for the next parotid reconstruction they had. There were some concerns mentioned about the incidence of partial flap necrosis, which would obviously then require partial flap debridement and some other form of reconstruction, which could delay the commencement of radiotherapy for these patients who often need adjuvant radiotherapy.
That's right, and that might delay things in itself, I suppose, yeah.
But overall, I think everyone thought it was a good paper, very interesting application of the Keystone principle, which Dr. Behan is able to apply for almost any defect anywhere in the body.
Yeah.
Okay, the final paper we looked at was...
Look, the final paper was the behavioural adjustment into toddlers and preschool kids with single-suture synostosis, or craniosynostosis. This is obviously a multi-centre study from across the states, Speltz being one of the major authors, and Cap Simmons has also been the other. Look, essentially they're trying to find no other studies actually been looked at, whereby we've got our own cohort of kids with craniosynostosis to that of their own respective age group of normal control kids. So I think it's a the first study in essence to do this. The result in itself was obviously that there was no actual great significant effect or change that's noticed in behaviour, looking at through the two major studies being that of the child behavioural checklist and that of the caregivers checklist reports. So it was interesting to come back with the results saying that there was essentially no significant difference between that of those control kids and those of the inpatients that were selected into the control, into the actual study itself.
Yeah, so it was thought that this was a very important paper, answering a very important clinical question. The limitations of the paper which were pointed out were, first of all, that it's a relatively younger age group. Even their second time point was still not a child who's well along in their educational years, and whether things might develop later on, behavioural issues or issues in terms of cognitive functioning. The other thing that was raised was this paper obviously relies on questionnaires completed by either a parent or a school teacher, and we thought it'd be really nice if we had an objective study where a behavioural psychologist came along and did an assessment on these children, was blinded as to whether they'd had craniosynostosis or not had craniosynostosis, and then actually gave an objective evaluation of what their intellectual function was like. But certainly it's reassuring for parents of children with craniosynostosis, single-suture craniosynostosis. We can then say to them, look, a recent study has actually shown that there are no major differences in terms of cognitive function for their children when they get a bit older.
Yeah, I 100% agree.
Fantastic. Well, that is the end of our video blog for the Plastic Surgery Journal Club on September 19, 2012. For those of you who were there, we hope you enjoyed it. And for those of you who weren't, thank you for listening.
Thank you.